Here it is. Have you learned it all yet? No, you haven't. Do you worry about it in bed at night? Yes, you do. Should you learn it all? You can't. No one can do this. This is the book of what? And what do we mean by the what? Oh, it's been on a step 1 exam. Well, let me tell you, I've talked to a lot of students about their exam, and these are students that I've taught. So I know how they learn, I know their capabilities and strengths and weaknesses. And when they come and talk to me about the exam, I can tell you this, memorizing step 1 isn't going to help you. Before we get into it, if you haven't subscribed yet, please do. I post a video every week on teaching you how to learn medicine. I'm Dr. Philip Tisdall. I've been in practice for decades. I've taught medical students for over 12 years, and half of that has been preparing for step 1 exam. One of the biggest sources of stress that I see amongst medical students is this terrible sensation that you should know everything. Well, you don't and you can't. So we start with this fundamental question. What do you need to know? And the incorrect answer is everything. Let's think about it for a second. That's just stupid. Of course you can't know everything. What you want to know is the difference between what do I carry around in my head and what do I keep on the long list that I look up. And that's actually called the Pareto law. It's 80-20. It says that 80% of all the things you're going to see are caused by 20% of all the possibilities. It's the 80-20 rule. It's the only way to manage medicine. And it's surprisingly powerful. Let's talk about a few examples. Congestive heart failure. 80% of congestive heart failure is due to ischemia, valves, and hypertension. Everything else, all those cardiomyopathies, long list. You don't carry those in your head. Chronic kidney disease. How much have you spent learning chronic kidney disease? Think about this. Diabetes, 45%, hypertension, 20%, glomerulonephritis, 15%, and just to throw it in there, autosomal dominant kidney disease, 5%, depends on your population. What am I at? 90%? That's all. Everybody else is just a little factoid. Nothing is more impossible than to learn the lymphomas. Trust me, I diagnosed them for 35, 40 years. I never knew them all. By the end, it was so impossible, I would give a general answer and send it out to the hematopathologist. Do you think anyone's going to ask you that question? They're not. So let's talk about then the hardest thing when you come to teach. And we talk about it as educators all the time. What don't you need to teach? Well, I guess it's the whole world minus what you do know. So let's talk about what you do need to know. You need to know common things. I'm going to define that as more than 10 or 20,000 cases a year. Everything else is uncommon. It's going to be factoid. The second is going to be rare diseases that teach principles. I love Cartageners, all 8.5 cases of it in the world, because it teaches you that the whole function of lung protection is the mucociliary escalator. So do you get the same disease if you can't move the mucus because it's sticky, or you can't move it because your cilia don't work? The answer is they're the same. So we teach Cartageners. It has an important principle. If you have a rare disease with no principle, not on the list of things I'm going to remember. You're not going to remember things that are impossible. And you know what number 1 on the list is? Heme metabolism. Not going to do it. I've learned it 6 times perfectly, and I've forgotten it completely and utterly 6 times. Good for you. If you want to put all that effort into it for the 4 weeks you're going to have it, it'll be a great 4 weeks, and then you're going to be just like me. Some things are just stupid to learn, and I use that word absolutely specifically. Nothing is worse than watching a practicing surgical pathologist teach ovarian tumors. There are 400 million, maybe more than that. You just can't do it. What do you do when there's a gazillion things and somebody in that specialty thinks they're all equally important? The answer is, well, no good examiner is going to ask you. Instead, they're going to say, show me the model disease. So if I tell you ovarian neoplasm, 80% of them are epithelial and 70% of those are serous carcinomas, got it. Serous carcinoma. I'm going to learn it, and everybody else is maybe a factoid. I guess we'll learn some of the ones that produce hormones. That's kind of an endocrine experiment. We got to know cystic teratoma. It's the commonest, and it's got those cool teeth. So it's not only common, it's got that coolness factor. And metastases. So when I teach ovarian neoplasms, you're going to learn the model and then 3 or 4 others that are factoidy. That's manageable. So when I say to you, how did you learn your testicular tumors? There's only one answer I want. Oh, a 30-year-old presents with a painless mass, and the question I'll ask is, did it transilluminate? Because the principle is cystic solid, benign neoplastic. 400 million types. Maybe they'll ask you a cell type and a protein, I guess, but there's a principle behind that, right? If there's a specific type of tumor, it produces a specific protein. Nice principle. I like that. So don't learn what you can't possibly remember. Don't learn things that are specially stupid. Don't learn things that you can't possibly see in everyday medicine. So what do you do about those impossibly rare things that you know you're going to get 1 or 2 questions on? You've got to differentiate knowledge from examsmanship. You in medical school should be saying, I'm going to learn how doctors think. I'm going to carry that 80% of examples that doctors use, and I'm going to save that 20% for the last whatever, how many weeks, 8 or 12 weeks you're going to use to prep for the exam. I'm going to have my lists of things I'm going to carry for the exam, and then I'm going to dump. All the inborn errors, you're going to get 3 of them. I don't know which 3. I'm not going to teach them. That's great. First aid's a good use of that. So what do you need to know? The most common things, always in errors, start with failure in an organ. You've just got to understand failure. Anytime we do the graph of chronic progressive disease, we go through our stages: asymptomatic because of compensation, tipping into symptoms when stresses tip you into failure, and then failure when you have symptoms at rest. Every chronic progressive disease will go through a common end pathway. To understand failure is to use structure function, is to use testing teaches pathophysiology, is to save half of all the learning because everybody's going to go there. So you go, oh, yes, well, it's cirrhosis as, did you have alpha-1? Did you have alcohol? Did you have virus? I don't care. It's a common end pathway. It must be 40% of everything you need in an organ. So the first thing you start with, what do you need to know? If someone comes to me and says, I've only got 8 to 12 weeks to prepare, I always go, well, don't miss your failures. What else do you need to know? You've got to come back to a lecture we had before. You've got to understand, and this is a very hard thing coming out of first aid, everything isn't equally important. So when you say, is this disease testable? The answer is yes. Good. How important is it? And you should give this hierarchy to your diseases. This is such an important disease. Even as a medical student, I'm going to know as much as a practicing specialist. Good example of that, cystic fibrosis. You've got to know that as well as you need it as a pediatric resident going into your specialty exam. AIDS. Just learn AIDS. It really matters. It teaches enormous principles. It's really important. You're going to see it in practice. Just master it. Then we come to diseases that are important enough that you should be able to discuss presentation, pathophys, natural history. Lupus, rheumatoid arthritis, gout, tuberculosis, really important diseases. You should say, who walks in the door? What am I going to see in physical exam? What testing proves it? Tell me why it all looks like that. Face your patient. Doctor, what happens to me? Prognosis. Anything we should look for? Complications. And then we get to treatment. You notice I didn't say pharmacology. I said treatment. Maybe it's mechanical surgery. Maybe it's drugs. Maybe it's radiation. But you've got to take all your significant diseases and have them at the presentation, pathophys, natural history level. And then we come to all the others. They're factoid. So you say, hey, what's interesting about this? So lymphomas are a great example of that, right? You're going to come to Burkitt's lymphoma. It has 2 really cool facts. It has Epstein-Barr virus growth. That's really interesting, viral oncogenesis. And it has a really cool translocation, c-MYC. And that lets you talk about transcription factors and how many pathways it activates. So it's one of the most rapidly growing tumors. Got it. It's a factoidy disease. And most of your lymphomas will be. Hairy cell. Bet it's got a really cool cell on the peripheral blood smear. Don't we all love it? Should I learn the markers? Well, I practice that and I don't know them. Every time I come to it, I have to look them up. And that's my general rule. If I don't carry it around in my head with me, I'm going to teach it as a, this is what you got to know. And there's a couple of factoids you can brush up before your exam. So everything isn't equally important. Diseases you know perfectly. Important diseases means presentation, pathophys, natural history. And all the others are, tell me what's testable about this. So here's the problem. In your heart, you know I'm right. The problem you have is that's not how the system is set up. And so what that means is is a large spoonful of trust in taking what I say to be true. That's fair. The first thing I have to do is trust. The problem with trust is everybody's really anxious. And anxiety takes us to ritual behavior, and nothing is a more calming to do than to memorize. So whenever I have a student that's really anxious, and I'm not going to send them down the first aid path, I give them some of those areas where we're sort of stuck, you have to memorize them. So that's like pharmacology, antibiotic mechanisms, some of your microorganisms. There's a few things you can practice memorizing. Now you're calm and your brain can listen. Let's talk about how you learn what's important, which is pathophysiology. You've got to be able to see the picture and tell me the story and then correlate that to your symptoms, your signs, your testing, and your treatment. But you've got to be calm and you've got to believe me. And I recognize it's my constant uphill struggle. Your generation doesn't trust my generation, and you're right. So what are you going to do about the fact that you hear me calling to you and you want to come and try it, but you're afraid to let go? Here's what I suggest. Take any system that we teach. Just commit to it. It couldn't harm you. You agree to that. And then go to whatever your exam bank is. I don't care if it's UWorld or Amboss, whatever it is, they're all fine. Go and tell me if your performance isn't better. That's the first measure. But the second is, don't the questions make sense? Because let's talk about examsmanship. You'll spot me that it's better as a doctor. I hope you'll just stipulate clearly I'm talking as a doctor, what you need as a doctor. So let's just accept that. But your exam is what you're worried about. Here's what I'll tell you about that. More questions are missed on exam because you're tired than were ever missed because you didn't know what the protein in Cartagena syndrome was. What do you do about that? The key to being strong is being fast. And the key to being fast is to have an accurate, sharp, really tight way of thinking about a disease. So when I say to you, hereditary spherocytosis, man, have you got the cell membrane? Have you got the membrane complex connecting to the actin cytoskeleton? Do you see that membrane blebbing off? Just like that. So the second you recognize the disease, you go, got it, moving on to what they're asking in the question. Not reading through, hoping for the hook, anxiety rising like a gorge into your throat, going, dear God, help me. And you miss the 5 questions at the end because you never got to them. Fast is smart. And fast depends on practicing. How does everyone think of this? Show me the pathophys. So you notice I've sort of been dodging around the question of what can you afford to ignore? Because no matter how many times I say it doesn't matter, you're going to say, oh, well, my second cousin Bob, he got that question on his exam. All I can tell you is don't trust what students say they heard on the exam. If you don't know that person and you weren't their study partner, here's the problem with that. Number one, everyone writes a different exam. You might get an exam that's an emphasis on immunology. Someone else will get an emphasis on pharmacology. Someone else might, I had one student get anatomy. Just because they got that on their exam doesn't mean you're going to get that on your exam. The second is every student I've ever talked to about the exam has said to me, it's a fair exam. And you say to them, well, what do you mean by fair? They go, well, even the things I didn't know, I agree you should. You know, like diabetic kidneys. So yes, there's a smattering of rare things. You're never going to guess what they are. That's for your examsmanship weeks where you have the list of carbohydrate enzyme deficiencies like anyone's ever going to see one. So what don't you need to learn? You don't need to learn anything that a practicing physician doesn't have any idea what it is. You can do some rare things because they're foundational, but generally speaking, all of your questions are going to be vetted by practicing physicians, non-specialists. So if it requires a specialist to know or use something, don't. It's way better to have command of important principles and diseases than it is to have that final list. Yes, you're going to make a trade-off. Of course you are. No one gets 100% in the exam. Don't try to. You want to know what 70% of the questions are and narrowing the remaining 30% to between 2 choices. You know what that's called? A really good score. And the way you're going to do that is by being able to read the question, understand the medical discussion, and then quickly say, oh, I know what image they're looking for. and then reading your question. And that is not some endless list of all the hormones that can do the gut. If they're going to ask you, it's going to be gastrin. If they don't ask you gastrin, it's a stupid question. You can't prepare for stupid. And now I'm going to shamelessly say, if you want a good way to know that, you can use the textbook, because I don't put in things that I don't want. I go through this a lot. It's really painful. I go, oh, but that's a really great fact. And then you go, no, that's a really great fact because you were a specialist pathologist. No medical student can do it. Okay, so if you need that tool that says, tell me how to think like a doctor, what are the things I have to know, and how do I have to know them? I wrote it all down in the book. Next week, I'm going to show you how to use the textbook, because all of your training to this point has not taught you the right way to learn medicine. And if you haven't seen it yet, see the previous video on structure function. I'll see you next time.